everyone. My name is Nana, and we have Cynthia, Valerie, and Whitney in our group, and we're going to be talking about professional growth. For the background, it was actually brought about around the second half of the 20th century, where actually the nursing leaders realized the importance of conceptual and theoretical frameworks for the development of nursing knowledge and professional nursing practice. There was a publication on American Journal of Nursing in 1959 that highlighted the necessity of expanding the body of nursing knowledge and opportunity for continuous professional development, professional growth. And so for significance, why professional growth is significant, we know that our nursing knowledge and nursing practice changes in fast pace. Changes and development in healthcare technology, which changes every day, and also our diverse workplace and diverse client that we have to provide for. And also the current healthcare focus on cost containment and cost reduction. That also puts importance on professional growth in nursing. Nursing shortage, which is actually really big, and it's considered actually one of the threats in our nursing profession. On nursing shortage, not only the recruitment, also the retention is very important. So research has shown that wherever there is more opportunities for professional growth, there is more nursing retention. Same thing with the job satisfaction. The more professional growth opportunities we get, we have more job satisfaction, which results in nurse retention. For the magnet recognition, which is recognition for nursing in hospitals, professional growth is one of the essential forces to determine that magnet recognition. Meaning in published work, in one of the studies, it says that it's a lifelong process. It involves the continuing clinical competencies, enhancing professional practice, and supporting achievements of career goals. It's achieved through either academic education or the continuing education, and also the staff development programs that's in the hospitals. Also enables to acquire new knowledge and apply that knowledge to the nursing practice. In the same study, it says that it's a key provision for nursing profession in ANA Code of Ethics. It affects nurses' self-respect, self-esteem, and professional status, and also meaningfulness of work. It enables nurses to actually contribute to the profession as well as respect their peers and their work. In the next study, it talks about the framework of professional growth, which includes the evidence-based practice, which is big in nursing practice. The evidence-based practice is to implement scientific knowledge as well as to facilitate development of more evidence-based practice. Both educational and practice environments provide key inputs for an effective lifelong learning. The professional growth could be achieved from diverse ways. It could be educators who actually facilitate and mentor the learners, researchers who actually disseminates the knowledge, and the administrators who actually advocates for resources or funding for professional growth. So all of these has a common core values of knowledge development, knowledge management, mentoring and peer review, and advocacy and ethics to set the foundation of professional growth. In the other study, it talks about how professional growth is key to the organizational and professional success. It's a part of professional accountability and responsibility, and it enhances career development, along with making eligible for accreditation and also professional recognition. It is guided by standard of practice. It involves nursing ethics, professional and patient diversity, and it promotes non-judgmental and non-discriminatory learning. So in general, the purpose of concept analysis is to examine the internal structure and function of concept, because it breaks down that concept into simpler elements. It provides operational definition and increases the validity of the construct. It encourages communication and promotes understanding among the colleagues. And the basic result is that we'll be able to create a hypothesis depending on what we discover from the concept analysis. So the purpose of our concept analysis and professional growth is that to acknowledge and understand the underlying attributes and theoretical basis as we take this journey from baccalaureate prepared nurses to the advanced practice registered nurse.
Hi, I'm Valerie Boyd. Definitions and defining attributes. Professional growth is an ongoing process into various stages that blends self-awareness with an acute scientific and objective viewpoint that allows the nurse practitioner to evaluate their own actions and progress in a proactive manner that continues to provide crucial clinical and life lessons for them. Antecedents to professional growth include individual desire to continue searching and learning, commitment to gradual improvement in professional nursing while developing a keen sense of awareness and self-knowledge, and deep self-reflection, understanding of how to blend the lessons learned about the self with those observed from the external world around are also included. Consequences. They're mainly positive transitions into new paths and structures. The three major transitions in nursing professional growth are doing, being, and knowing. Doing involves exposure to knowledge. Initially, there's little contributions back to your field. You're basically just doing what you're told. Being, later a nurse can expand their experience through actually acting on that knowledge. And then comes knowing, becoming a method of change and innovation in a field where they were simply a worker before.
Hi, I'm Cynthia Pippins, and I'd like to talk with you for a few moments about the type of cases that are associated with this. We have 5 types of cases. They include model, related, borderline, contrary, and inventive. First, I'd like to talk with you about model. Model is defined as a perfect example of a defining attribute of a concept. Basically, if that's not it, then nothing else is. One that I'd like to utilize a new nurse trying to learn how to work on the floor, and I'm going to use an example of her first day, which is basically me. I'll go ahead and admit it. Completing all the patient's tasks without really checking back to the nurse's station. It took me about 4 hours to complete my morning care. I did miss orders, and I had patients waiting for discharges, and it was really just unorganized patient care. So I went back and I reassessed what didn't work for me. So I knew that couldn't keep going, so I had to come up with a better plan. So the next day, I rounded on my patients first thing to make sure that they were stable, and I developed a realistic plan of care for patients that allowed me time to implement new orders and complete tasks throughout the day. I completed my morning medications and assessments together, which I actually completed them within 2 hours. And about every 2 patients, I'd go back to the nurse's station and check for new orders so that I could kind of include that in my care that morning if I needed to. Related cases are defined as cases that are similar to a model case, but they kind of represent a different concept. And I'd like to kind of compare professional growth versus professional development. Professional development is defined as a constant commitment to maintain one's knowledge and skill base. An example of this would be an associate degree nurse returning to school to obtain a baccalaureate degree. It exhibits growth of the individual. It does not ensure critical problem solving or incorporate new knowledge to new situations. Borderline is defined as using the same word in different contexts. An example of this would be a nurse transferring to a different unit to expand their nursing knowledge. For example, a nurse moves to a different unit. She's going to gain clinical experience, and she's going to enhance that nursing knowledge. Even though the nurse has technically gained professional growth, they may continue to use the same routine in their nursing care. This type of professional growth does not necessarily exhibit growth of an individual. Contrary cases are defined as cases that are not representative of the concept. Basically, if there ever was an example, that's not it. An example that I used was Washington State Department of Health reported a nurse accused of unprofessional conduct in reference to a medication error. She gave an IM medication, IV. She was aware of the route error. She gave it that way because that's what the doctor's order said, but she failed to notify the doctor of the conflicting route of the medication and ultimately caused her patient harm. Invented cases are those cases that contain ideas outside of our own experience, and one that I thought would be really good to use was new parents, and I liked it through another little added thing in there about their twins. So we're going to use John and Anna as proud new parents of twin boys named Noah and Jacob. Nap time, that's always challenging even with one newborn, let alone two. During nap time, Anna would change Noah's diaper and place him down for a nap first. He was really the easiest one to get to take a nap. And when Jacob would finally go to sleep because he was more difficult, Noah would wake up. Hectic nap schedule left no time for Anna to do anything else. So she knew that she had to come up with a new routine to make this work because she couldn't continue this. So what she tried the next time was she changed both boys at the same time. She placed Jacob in a swing, and she rocked Noah in a chair beside the swing, and she would sing softly to the boys. And they both went to sleep, and she gently placed them into the crib, and they slept for about an hour. So this new way gave Anna more time to actually spend for herself, and she started doing that every day. Thank you.
Hi, I'm Whitney Guerrero, and I'm going to talk to you about the empirical indicators for the concept of professional growth. There are quantitative criteria as well as qualitative criteria. Now, criteria are used primarily as tools to commence further processes related to empiric theory development. For the quantitative criteria, they are more concrete criteria that you can use numbers to measure. So, like, our quantitative criteria for professional growth are the number of times an individual is promoted, the number of recognition rewards presented to a person for outstanding work, and the scores on the patient satisfaction surveys for a particular unit, clinic, or wherever the nurse may work. As well as the scores on employee satisfaction surveys for a particular unit, clinic, and like I said, wherever the nurse may work, the number of degrees and or certifications of an individual, the number of staff development programs in which a person is involved. Now, the qualitative criteria are more abstract and more about like the feelings of the person. So, like the ones we chose were the person obtains a knowledge base of a particular area and continues to gain knowledge via education in the area and through reflective practice. Some positive feelings are felt by the person who grows professionally due to self-satisfaction and feelings of autonomy. Also, the person displays efforts to learn more about a particular area. The person utilizes the new knowledge and skills obtained appropriately. That's important. They have to use it appropriately in order to build onto previous knowledge. And the person is able to contribute to the knowledge of others via guidance and teaching. I thought Patricia Benner's model was a perfect example of professional growth. It's based on the works of Stuart Dreyfus and Hubert Dreyfus, and it describes the 5 levels of skill acquisition and development, from first the novice to the advanced beginner, then competent, proficient, and then on to the expert. It can be applied to nursing discipline or any other discipline to illustrate how an individual is progressing and applying knowledge and skill development appropriately. So the operational definition of professional growth is well, first let me talk about what an operational definition is. It's the concept that summarizes the insights that are created when conceptual meaning is being formed and succinctly conveys the fundamental meaning of the concept. So our operational definition for professional growth is the lifelong expansion of knowledge and skills obtained by professionals in his or her career, such as in the nursing discipline via continuing education, additional certifications such as becoming a critical care nurse, recognition awards, staff development programs, and reflective practice. Professional growth is behaviorally expressed via the application of knowledge and skills in appropriate situations, as well as through guidance and contribution to others' knowledge, efforts shown to continue learning, and via the experiences of feelings of autonomy and self-satisfaction as knowledge and skill development continues to expand. So in summary, the concept of professional growth can be applied to any discipline in which one has a career, including the discipline of nursing. Nursing knowledge is dynamic and it continues to grow. It's ever-changing. And therefore, the augmentation of implementation of knowledge and skills obtained defines the quality and characteristics of nursing practice. Professional growth, like I previously said, is achieved via continuing education and reflective practice. It's achievable by many in the nursing discipline, such as researchers, educators, administrators, as well as clinical nurses. The various cases that Cynthia mentioned, including the model, related, borderline, contrary, and invented cases previously identified, display examples of how different situations are related to the concept, or maybe how they are different or contrary. Individuals such as nurses must want to grow professionally and should put forth the effort to obtain new knowledge and skills in order to achieve the concept of professional growth, with the intention of all nurses to provide high quality, effective care. Thank you.
I think